Hyperaldosteronism is an endocrine disorder of the hormone aldosterone. It is an excess secretion of aldosterone by one or more of the adrenal glands. Aldosterone helps with the reabsorption of sodium and water. It's commonly caused by a tumor on the adrenal gland called a adrenal adenoma. So here we have the adrenal adenoma on the adrenal gland, which leads to an increase in the release of aldosterone, excess release of aldosterone, which then causes an increase in sodium retention, because we know that the aldosterone already reabsorbs sodium and water. So you're going to find an excess of sodium retention, which will lead to the excess of total body sodium, which overall will lead to excess fluid volume, because water follows sodium. So you're going to see the excess fluid volume with the excess retention of sodium. So then it's going to lead to an increased fluid volume, which is going to increase the blood pressure. So you'll typically see hypertension in patients with this. The increase in blood pressure is going to lead to plasma volume expansion, which is then going to decrease the renin levels, and it's going to lead to an increase in potassium loss. So signs and symptoms of hyperaldosteronism include headache, fatigue. You may see polyuria or excessive urination. The patient may present with muscle weakness or loss of stamina. And the three main things that you're going to see are hypernatremia, because there's going to be that excess retaining of the sodium. You're going to see hypokalemia, because there's going to be that excess loss of potassium. And you're going to see hypertension again due to the increase in the fluid volume. So diagnosing these patients, it can be diagnosed through monitoring their lab values, again watching that sodium and potassium, or a CT of the adrenal glands to determine if it's a tumor that's causing this. Some interventions: we want to monitor the patient's blood pressure, because we know that it can increase in this condition. We want to monitor their intake and output to watch that fluid volume again. We want to monitor their potassium and sodium levels, because we know that there's going to be a loss of potassium and an increase in sodium. We're going to want to do daily weights to monitor that fluid volume again. You're going to want to introduce a low sodium and high potassium diet to the patient, again, because we know how it affects the potassium and sodium in the body. And you're going to also want to monitor for signs of metabolic alkalosis, like hypoventilation, tetany, or change in mental status. Due to the excess hydrogen ion loss, these patients are at greater risk for metabolic alkalosis. And some treatments for these patients may include surgery, an adrenalectomy. That's typically if the patient's hyperaldosteronism is caused by a adrenal adenoma. And drug therapy typically includes potassium-sparing diuretics. The most common one used is spironolactone, and that is hyperaldosteronism.